Hi, I'm Shane Hall. I'm here to help you grow your dental or medical practice. And in my last video, I talked about how you can actually increase your new patient numbers without increasing your marketing budget. And I gave you two really good tips for how to do that. The first was to close the missed call gap that's happening in your office. Again, we know that in an average dental office, 40 or 50 potential new patient calls go unanswered every month. So the first thing you want to do is you want to close that gap, not miss all those potential new patient calls coming into your practice. The second thing I talked about was improving your staff's performance on the phone, helping them to actually convert more of those potential new patient calls into actual new patient appointments. And then I told you you'd have to come back and watch my next video for me to tell you how to do that. So that's what we're going to do right now. So to solve that missed call problem, to close the missed call gap that's happening in your office, what you need is to have a system or process in place so that anytime there's a missed call, and let's define a missed call, any call coming into your practice from a potential new patient that either goes to voicemail, is just not answered, there's a busy signal, anything other than a live person in your office picking up the phone and speaking to that person, we'll count that as a missed call. So that could also happen after hours, on weekends, anytime that you're closed. You could have missed calls. So what you want to have is a system and a process in place so that anytime there's a missed call, that person gets a call back from someone from your office within 7 minutes. Now why 7 minutes? Well, our research has shown that if a potential new patient calls in and does not connect with somebody right away, that you've got about 7 minutes to get back to them to salvage that new patient relationship. Anything beyond 7 minutes and your odds of converting that person into a new patient falls off a cliff. So you have to give them a call back within that first 7 minutes. Now to improve your staff's performance on the phone, for them to actually convert more of these new patient calls into actual new patient appointments, there's a few things that you want to keep in mind. You want to have them follow telephone best practices. If you don't know what those are, if you'd like some more information on best practices, call the number on this video or visit alphadogdigital.com, get in touch with us, and we'd be happy to send you some free information about that. Your staff might also benefit from some formal training. We find that only about 5% of office staff answering the phone in a dental or medical practice, only about 5% of them actually have any formal training. So your staff could most likely benefit from having some formal training on how to be better on the phone. A third option that we find works very well in a lot of cases is to implement incentive programs. When you have an incentive program that pays out bonuses to your staff based on their new patient appointments that they book on the phone, now you have a more motivated employee. You have a more motivated team member because they feel like they actually are part of the team in a bigger way. They have more to gain by doing a better job for you, and everyone benefits. If you'd like some information on a patent-pending solution to helping you not miss any more new patient calls coming into your office, or maybe you'd like some information on some proven employee incentive programs to help your staff be more motivated to do a better job for you, to book more new patients. If that interests you, I invite you to call the phone number on this video or visit alphadogdigital.com. We'd be happy to help. I'm Shane Hall, here to help you grow your dental or medical practice.